Government loses billions to ghost workers at public hospitals. Pindula News reports. Hello viewers, welcome to Champions Network TV. Zimbabwe's largest public hospitals are hemorrhaging billions of dollars in public funds due to ghost workers, poor record keeping, and a complete lack of oversight, the Auditor General's report has revealed. Acting Auditor General Ray Kojinga uncovered alarming levels of mismanagement at central hospitals, including Pilo, UBH, Engusheni, and Parenyatwa. The report reveals instances where salaries were paid to people who no longer work there, medicines disappeared from shelves, and unqualified staff were found treating patients. At Mpilo Central Hospital, 4 former employees who had resigned months earlier still received a combined total of 40 million Zimbabwe dollar simply because the payroll had not been updated, said Kujinga. The hospital failed to submit monthly staff returns. This allowed resigned employees to continue receiving salaries. While hospital management insists the funds were recovered and that new systems are now in place, the rot runs far deeper. The Auditor General's report revealed that inventory worth 161 million ZiG was unaccounted for, and donations valued at 215 billion lacked supporting documentation. There were no internal audits and no functioning boards to provide oversight. At United Bulawayo Hospitals, UBH, key staff including radiographers, doctors, and nurse aides failed to appear for physical verification. The Human Resources Department was unable to produce leave forms or jute rosters to account for their absence. The report also revealed that some staff were working without valid practicing certificates in breach of the Health Profession Act. At Engushen Hospital, inventory controls were found to be in disarray, although records showed 1,611 units of phenobarbital. The pharmacy had none. Other supplies, including fuel, bread, and sugar, were also listed but missing. The report criticized the hospital's inventory management and called for regular reconciliations to prevent fraud and drug shortages. At Parenyatwa Group of Hospitals, the mismanagement continued. Medical aid payments were not reconciled. Capital projects were left incomplete, and ghost figures persisted in the accounting books. In one case, a data balance was recorded at 5.408 billion ZiG in the hospital's books, while the Medical Aid Society reported owing only 4.96 billion ZiG. Crucially, none of the 4 central hospitals had operational management boards despite legal obligations under the Health Service Act and the Public Entities Corporate General Governance Act. Kujinga also raised concern over the repeated failure to address findings from previous audits, including those dating back to 2020. Of 10 recommendations made in earlier reports, only 1 had been fully implemented. Thank you for choosing Champions Network TV. If you are visiting this channel for the first time, kindly subscribe so that you don't miss our future uploads.